in Kantipur publication with implementing digital media since 2008. With short introduction, I would like Mr. Koirala to present the presentation. Thank you.
Thank you, Kiran. I just say Kiran because he's one of my old friends, so I coincidentally met him here. Namaste. I would like to thank the organizing committee for providing me this opportunity, and I'm going to present on the role of journalism and social media in disaster response and healthcare advancement in Nepal. Basically, I'll be sharing my experience while covering the two major events, the Nepal earthquake 2015 and the COVID pandemic. But Nepal, as we know, is prone to natural disasters, including earthquake, and we are now in the monsoon season, and the landslides and floods, etc., and the monsoon weather-related events are likely to cause more disaster now. So I'll be touching these events also. Journalism, as we talk about, is the means for communication. It acts as the communication tool during crisis times. And as I mentioned earlier, Nepal is vulnerable to natural disasters and outbreak of various diseases and public health situations. And we feel that there should be a synergy between healthcare and relief efforts. So journalism has an important role in delivering timely and accurate information during emergencies. It acts as a bridge between the general public and the authorities in terms of disseminating information and providing relief and other help whenever it's needed. Journalism is a pillar of crisis communications. I mentioned it earlier also. And traditionally, we've been practicing journalism through newspapers, radio, television, and of late, due to the evolution of the digital media, the new form of journalism, new media has evolved, and there are online news portals, and social media has been indispensable tool to deliver information, disseminate information, and to reach out to the public. And during the earthquake and COVID pandemic, news agencies did real-time updates and provided guidelines to the general public and served them. Social media is more useful in terms of reaching out to the general public during disaster time and in disaster response. During Nepal earthquake, Twitter data was analyzed to track the spatial temporal flow of information, and there were maps, Kathmandu Living Labs and Humanitarian OpenStreetMap crowdsourced maps within 48 hours to aid rescue planning and resource distribution. And you probably remember how Facebook provided this feature of safety check and social mobilization, and over 7 million users marked that they were safe. And when the earthquake happened, I got some calls from the United States and other countries. My friends and family members reached out to me, but because of the poor phone network, it was not possible. But when the Facebook brought in this feature, and I marked that I was safe, they were happy to see that. And when I said I am a representative character, it was useful for other people also. And in journalism, we've started using new technology and real-time tracking, social media monitoring. Both of these things are done. And when we talk about social media monitoring, people are there in right time, or say right time at right place. Connotation probably says that, but sometimes it's not possible for the media personnel to be everywhere, so people are there on the ground, and when they write something on social media, we media personnel keep on tracking the trends, and we collect the information, verify them, and then sometimes, during the crisis times, misinformation and disinformations are spread like wildfire, so we verify them, and then if something wrong is talked about, if the misinformation is being spread, then we challenge that, we boss that, we talk to the authorities and the experts and say that this information is wrong, don't follow that. And journalistic best practices during disasters include prioritizing safety measures, ethical reporting, and combating disinformation. I talked about misinformation a while ago. And while talking about safety, we promote the use of protective gear, emergency preparedness, and crisis response coordination. And the most important thing is ethical reporting. We focus on accuracy, avoiding sensationalism, and respecting victims' dignity. During disasters, people spread information without knowing whether that's right or wrong. And there are some media outlets, and to be particular, YouTubes and TikTok users, they try to sensationalize things, knowingly or unknowingly. They probably have some vested interest on that. So mainstream media people, we focus on ethical reporting. While reporting or preparing for the crisis reporting, we do some background research and then build a trusted network. We reach out to the emergency responders, NGOs, government sources, and experts. Experts may be in Nepal or abroad, so their perspective, their opinion, and their views, that matter a lot. And the journalists who work on disaster response, their mental health is also important. So we focus on their mental health resilience also. As I mentioned earlier, the information disorder, misinformation and disinformation, it has caused a lot of damage to the reporting and the mental health of the general public also. So misinformation spreads in disaster times because of various reasons. One of the reasons is fear-driven psychology. In moments of panic, people are prone to share unverified news, and then that spreads very rapidly. And there are echo chambers, there are closed groups. They talk about things and they, without verifying the information, they say that. And I mentioned earlier also, people are into clickbait journalism and sensationalism also. Some YouTubers and TikTokers, they spread false news knowingly, because by doing that, they can earn more views and money. And manipulation during crisis also, there are some vested interest groups, so they try to manipulate information. So, and when we talk about real-world impacts in Nepal, earthquake and COVID, during earthquake times and COVID pandemic, there were fake informations being spread around. So, as a member of the mainstream media, I can say that we vouch to bust those misinformation and try to offer right and correct information. And for that, we have to break the chain. Fact-based reporting is the key, and social media as a tool for truth. At present, people have to be spoon-fed. They don't go to the mainstream media directly. The social media platforms are the link between people and the media outlets. So social media can be more important tool. And building a public health media literacy is also important. There are fact checkers, we have to support them. Even the media outlets, they have been practicing that. But besides that also, there are individual and independent fact checkers. They have been very helpful. Thank you.
Thank you. Thank you so much.